Hi there everyone, my name's Helen and I'm sat here with Luke today from Hilton House Medical, and we're going to have a sit down today, aren't we, and discuss about women's health and men's health and what things we can offer to men and women out there at Hilton House. So when I'm thinking about my own health, for example, then immediately I'm thinking about things such as smear tests, coming in to speak to you about any lumps and bumps that I may have, and checking on things such as if I'm on the contraceptive pill, are we doing checks about that? And in terms of smear tests and any lumps and bumps, well, if we take smear tests in particular, obviously we're aware that there's an age restriction on that.
Yes, yeah, and it's, I think, once a year, once every few years maybe within the NHS. It's sometimes difficult to know. It's just because I work in this environment where it's super flexible, you sort of, whatever you want within reason, you can get. This idea of having on things only once a year, or, you know, having them years apart, or that they can only start from a certain age, is kind of alien. So yeah, well, I mean, we offer smear tests to anyone over the age of 18 as often as you would like. I can't imagine you want them that often.
No.
But as and when you might want one. There's no restrictions there in terms of us providing that service. We have a female GP who, you know, obviously for those sorts of things.
Because that's always good, isn't it? That you've got the option
absolutely
to be seen by a lady.
Yeah, we want to make people as comfortable as possible. For the contraceptive pill, we can set up consultations to discuss sort of where your current medication is at for that. What sort of contraceptives are you taking? How is that affecting you? You know, what the alternatives might be. And again, giving you loads of time within these consultations, you know, 30 minutes minimum really, to go through and discuss these things in detail. You know, we're not trying to rush you out the door. We want you to feel like you're being listened to, because you are being.
And it's a nice modern setting here as well, isn't it?
Yeah, absolutely. Yeah, I think it's really welcoming.
Sometimes it can be quite scary, can't it?
It can,
going into a very clinical atmosphere.
Absolutely, but I think you'd be surprised the power that a cup of coffee can have.
Oh, absolutely.
You can just take a hot drink, take that into the consultation room with you, sit down, relax, discuss. It's
exactly.
We do a lot here for women's health.
And speaking about our doctors here, I mean, they really do put you at ease. They really are. They take their time, their persona, the way they talk to you. They're not dismissing any of your symptoms. They're not saying, you know, this might just be in your head. You know, they appreciate that you know your own body better than anyone else.
Yeah, absolutely.
And you're coming to us to discuss something that's concerning you.
Yeah.
And the fact that we can offer the 30 minutes or even longer if some people want, I think is a brilliant idea, especially for us ladies who may feel that at times we haven't been listened to.
100%. And I think that's something a lot of people come up against, is that feeling of not being listened to. And we really are making an effort to, you know, go against that and make you feel like you are being listened to and you're being taken seriously, that things aren't all in your head, and that you know, your health is being taken seriously.
Because as busy mums, like I am one, you know, you often put everything on the back burner and you're worrying about everybody else and making sure everybody else is okay and not thinking about yourself.
Yeah. I think the nice thing about the half-an-hour consults as well is that for people with very busy schedules, mums in particular, is that half an hour gives you an opportunity to get through a lot of different problems in one visit. You're not having to take 10 minutes, you know, here to go and do this one, and then a week later, 10 minutes again for another issue. And you say, it's only 10 minutes in the doctor's office. You're taking however long to get there, however long in the waiting room.
Parking can be a nightmare.
Absolutely.
Yeah.
So being able to either spend loads of time on one problem really in depth, or maybe use that time to go through 2 or 3 things, is really, really helpful in terms of someone who values their time like that.
Yeah.
And if people need even longer, then there are an hour consultations. You know, we don't really have a limit on how long you want to spend with the doctor.
Mm-hmm. And I've had a lot of people talk to me about that obviously they feel that they could be going through the menopause.
Mm-hmm.
And I'm glad to hear that we just don't say, well, if you're suffering with night sweats, then you must be going through the menopause. Because we all know it's not just about sweats.
No, absolutely. I mean, we offer blood test profiles that would check hormones and be able to check all the things that are related to the menopause. But also, it's taken seriously.
Yes.
You're not just talking to a brick wall here.
Yeah. Because it can be affected by many things, can't it? It can obviously ultimately is down to your hormone health and how they're fluctuating in your body, and that's making you possibly moody, snapping at people, maybe not having enough energy, and often feeling sort of quite redundant in your role as a female because your children have grown up and you're not needed as much, so you're often feeling quite low as well. And that's another reason that we take it seriously when people are going through those symptoms, and we understand that it's not just pinpointed to one thing.
And I think that there's a consistency of care as well. You know, I think a lot of times with the NHS GPs, you can feel like you might be waiting a little bit too long in between appointments, in between checkups, where you feel like, have I been forgotten about at stages? Is someone on top of this? Have we did blood tests over 12 months ago. Where are we at now? You've got to go through the whole rigmarole of getting a test done again.
Yeah.
There's none of that here. Absolutely none of that. You'll be seen as often as you would like to be seen. We're always here for consultations, for new blood tests if you want to get things redone after a certain amount of time. Obviously, the doctors will recommend, sort of how often you might want to come in. Check back with us in 6 weeks. Have some more bloods done in 3 months. But if you're a bit worried and you feel like I'd rather see someone a bit sooner, it can be done. It's not a problem at all.
Yeah, and it's really easy to book with us, isn't it?
It's super easy.
It's amazing that we can just book online. And we can do it the old-fashioned way as well if you want to call in person and make an appointment.
And there's no long waiting times on the phones. No long waiting times. I hate that with a passion.
Oh, I do.
Oh,
and the automated system as well.
Yeah,
and you get sick of hearing the same music, don't you?
None of that. There's no waiting times on phone calls. You can email us as well. And generally, we do have to book the appointments either over the phone or through our online booking portal, just because we need to get some details. And we'd rather not do some confidential information over email. But through the secure booking portal and through the telephone, it takes 10 minutes and you've got an appointment booked with us, usually within 48 hours.
And if somebody was to come in and they've had a smear test with us, and then we've invited them back in to discuss the results of that smear test, and if for any reason further testing is needed, how quickly can we get people seen? How quickly does our referral process work?
So if you're asked to come back in for an appointment, it'll be, like I say, usually within 48 hours. We'll get you back in for a consultation. If further blood tests are needed, or any further diagnostic testing, then if we can do it here, it'll either be the same day or next day, or just whenever you're next free. We have blood testing and diagnostic services available Monday to Friday. If, for instance, there's a scan that's required that we can't do on site, Then we'd get a referral sent off the same day that it's needed. You'd send that off to a private facility, and they tend to be pretty rapid in getting a response to you. I think a lot of places it's well within a week before you'll hear from them about next steps with that outside provider.
And that's always one of the worst things, isn't it? The waiting around, waiting to hear back. When you're looking to find out about something, or looking to find out about certain tests that you've done, you want to know pretty much instantly,
totally
don't
anxious
you?
about it, and that's understandable.
Yes.
So yeah, we want to try and minimise that waiting around time, because it doesn't do you any good. So yeah, as soon as we get results, as soon as we get anything, it's being actioned, and it's, we're moving on to the next steps. Yeah, it's another one of the perks of coming to us.
But within our well women checks, I mean, people often forget that, yes, there are certain diseases out there that we hear about all the time, if we take cancer as one. But people forget about heart disease as well, which is one of the biggest killers in women, for example. Obviously, it's in men as well, but it would specifically in women.
As well,
So it's always good to get your cholesterol checked. If you're very health conscious and you're down the gym, like we all are, we all wanting to keep fit and strong, because us ladies, as we age, we lose our bone density. And so we're trying to keep up with our strength training, etc. But obviously checking your cholesterol as well, and your blood pressure needs to be checked regularly to make sure that everything is just keeping on a nice even keel, and nothing's going to suddenly one day come along and bite us.
Totally. It's about being preventative of these things. We don't want to fix these things after they're occurring. I mean, everything you've just mentioned is all included in our well person checks, but specifically the women's side. The tests are there. In fact, I've got the tests with me, actually. Let's have a look. So we are testing for cholesterol. We're also testing your thyroid. We do full blood counts. You're looking at your use and eat, so kidney health, liver health. But specifically for women, we have a test that's just looking for ovarian cancer, just to spot any early markers of them. Things like glucose and insulin levels. So looking at diabetes risk, things like that. And that, in conjunction with body weight measurements, ECGs as well, looking at the heart rhythm, making sure that there's nothing sinister going on there. We can really give someone a great overview of their health. And we present it in a way, after you get one of these checks done, you give it a report. And this report, I've seen a lot of blood test results, and it can quite often be a little bit bewildering as to what you're looking at.
Yes, it can.
So the report is done in a super readable way. It's dead clear. It's dead user friendly. It gives a great insight into your overall health.
And then of course our doctors will then advise, won't they, what steps you can take. There's lots of things that we can discuss before we actually go down a medication route, isn't it?
Yeah, absolutely. And we have different tiers of our well person checks. So you can start off with just having the tests done. It may not be the full range of tests, but some of the tests done, and take it from there. Or you can go up a couple of tiers and spend a lot of time with the doctor discussing things, have the test done the same day, and then the doctor can sort of have a picture of your lifestyle as well that surrounds these tests. Just giving him or her a great overall picture of where you're currently at in terms of your life and your health, so that when those results do come back and you're brought back in to discuss them, it's a really well-informed discussion that the doctor's able to have with you. Which I think
is priceless, really, isn't it? In a sense, because I think, like you've mentioned, we are very much about preventative healthcare. We are wanting to keep people healthy and well, and we don't expect to see people all the time. However, if you're on a certain journey with your health, it may be that your cholesterol has been high and you've been working on trying to get it down, then obviously we would invite you back in a certain time frame just to check how things are.
Yeah.
And it's the same if your blood pressure's been overly high, again, we'll be inviting you back to check on that. But we wouldn't, we don't expect to see you all the time. But what we're saying is, don't feel that we'll give you this information and say, bye-bye.
Yeah, off you go. No, yeah, we it's so useful to be able to have these checkups and coming back in just to see where you're currently at in your journey. It gives you great information on if things are working, what maybe needs to change going forward, what things could be more effective. We have a lot of that with people trying to reduce cholesterol, or maybe if you're trying to lose weight.
Yeah.
We have some options for that as well, treatments there. And it is all about getting you in every few weeks, maybe every couple of months, just to see, right, where are we at? What can we change? What needs to stay the same? Are things working? Are things not working? Instead of saying, come back to us in 6 months to a year, and we'll see where you're at. Well, if things have gone wrong, that's 6 months of things going wrong,
exactly,
or going in the wrong direction. The consistency of care is really, really important.
It is, and seeing the same people as well. It's always nice to see the same doctor, isn't it?
100%.
We don't have a huge team here, but we have enough of a team. And like you've pointed out, we have male and female GPs. And they're super friendly and very good at listening and taking on board what you're saying and not passing any judgment.
Yeah.
So thanks, Luke, for going through some of the issues surrounding women's health. But equally, I'm also interested to know what we can offer to our male patients out there, and what kind of things do we offer for men's health.
We have these well person checks, like I mentioned, for women, but we also have a men's version as well. There's some slight differences in the test. We're looking at maybe the levels for the prostate as well in there. So we offer a lot of the same services for men, but I think men maybe come at it slightly differently in terms of, I don't think men are quite as either switched on or willing to chat about their health.
Oh, absolutely. They seem to bury their head under the sand quite a bit.
Yeah. I think sometimes you're just terrified of wasting people's time.
Yeah.
I've been there. You don't want to make a trip to the doctors if you feel like it's unnecessary, or you feel like someone else might need it more than you do.
Yeah.
This is the beauty of having us as an alternative, is that even if you maybe are worried about sort of wasting someone's time, that worry can quite quickly go away if you're investing yourself into it.
But you mentioned something about prostate. So everybody has these preconceived ideas of what's involved in that kind of test. Can you just talk us through what actually happens?
Totally. It's a blood test initially.
I can hear them all there out there now. Yeah,
totally. It's a blood test. We're just looking for initial markers. First of all, we're not going, whole hog. We're just looking at initial markers, and again, the same applies as we talked about with smears. There is no age at which you can start getting this test done. It's not like we're going to say you can only have it done every 12 months, every 24 months. You can come in whenever you like, have this blood test, get an idea of where your levels are. If there's some underlying concerns that have maybe brought this to your attention, then we can set up a consultation as well. But if it's primarily just concerns about your prostate, then we can do an initial blood test that really should put a lot of concerns to bed initially.
And it's so important to get checked, isn't it?
Absolutely. And again, it's about staying on top of it. It's about being preventative. Off the top of my head, it's quite a cheap test, all things considered. So being able to do that test every 6 months, every 12 months, however often you want to do it, really, is great.
It's great to have that choice, isn't it?
Absolutely. Yeah, for other things on men's health as well, I think a lot of men are curious about their health, but until things go wrong,
that's when they panic.
Yeah, that's when you panic, and that's when you go in. So things like a major one that we do is testosterone testing, right? The majority of guys out there don't have a problem with testosterone, but you see it all the time as you're battered with these social media adverts saying, check your testosterone, you may have low testosterone, are you feeling these symptoms?
Yeah.
And they'll send you a kit in the post, and you do a little blood sample for them, and you send it back off to them, and it'll either come back saying that you're low in testosterone, which I don't know what ranges they're using. It seems like they flag low testosterone more than they should.
Yeah, it does.
Or you don't have low testosterone and everything's fine. Well, if you're still not feeling okay, then you haven't answered your problem.
No.
You've got these symptoms, but it's not your testosterone. So you're pretty much back to square one. All you've done is gone, well, it's not this. But what is it?
Yeah.
We can offer consultations there. If you come into us and do a testosterone test, which you don't need to be justifying why you want one done. If you come into us and just say, hey, I'm curious about my levels, great. We can do you a test. It's not a problem.
Exactly. And a lot of the tests that we do involves a simple blood test, doesn't it?
Yeah.
It's not so invasive.
No.
It's a simple blood test, and it can give us a really good picture.
Yeah.
And I think it's great for us to be having these conversations because most importantly is we're all investing in our health.
Mm-hmm.
I think we would all feel more comfortable if we had control of it. And we decided when we were going to book that test, this test. And once we've got that information all in front of us, then we have the knowledge then whether, it might be that we just need to lose a bit of weight, or, we might have to have a certain test done privately elsewhere.
Yeah.
But having all that in front of us takes the power away and gives it back to us, and we're in charge of ourselves.
Absolutely. You are. It's not like you're not treating yourself, but you're coming in almost in your head with a plan of, I want this done. I'd like to do it this way, and our doctors are here primarily just to give advice. If you want to have a test done every 3 months, but the doctor would usually be like, well, maybe every 6 months might be better, then you can have that discussion of, well, why do you want it every 3 months? If you do, you can, but maybe there's something you might not have realised about this test, which is why you'd have to leave it a little bit longer in order to get more. It sounds counterintuitive to say leave it longer to get more information, but there might be reasons as to why the levels are the way they are at certain times. It's giving the patients a lot more power, but not so much where the doctors aren't still here to be giving advice and guidance and helping you along the way.
It's never a good idea, is it, to really jump online on the back of what you've heard from social media to start looking for something that may not be legal, may not be for human consumption or whatever. It's always best to speak to a doctor.
Yeah, 100%. Something else that, for men's health is the mental health aspect side of things. Now, whilst we don't necessarily specialise in mental health services here, we have these longer consultations so that you can come in and feel a bit more comfortable. You can take time, settle in, have a hot drink, and still chat about these issues, and we can very quickly direct you to the places that you may need to go and the services you may need to utilise. I think there's a lot of concerns surrounding mental health and how your physical health can affect your mental health. And if you're starting from a point of, I don't want to go to the doctors because I don't want to waste anyone's time, it's very easy to do that if you're not feeling great in your head. You know, you feel like, oh, I don't really feel like I'm worth much. I'm not going to go and take care of myself.
I haven't got the time.
Or I haven't got the time. I haven't got the time. People feel snowed under.
Yeah.
Which is, it's where having an inviting setting, where being able to have a longer consultation to make you feel more comfortable, but also be able to talk about multiple complex issues in just one visit, so you're not constantly to-ing and fro-ing, is really beneficial for a patient.
Well, we were talking before about with women's health, us busy mums often put everybody before ourselves, and it's the same with men as well. They're busy providing for the family. They feel very much that they are the provider and that they've got this huge responsibility to make sure that there's a roof over everyone's head and that everybody's doing okay. But life has its twists and turns, and there may be some times where they don't feel like that, and they're starting to feel maybe a little bit depressed, and just having someone to talk to, just coming in, and again, what we said before, not being judged,
being listened to,
sat down and spoke to somebody. You can do that here. Don't feel that you can't do that because you don't think there's anything wrong with you.
100%.
You can come in and just have a chat with us.
Just picking up on something you'd said there, the idea of, a lot of men feeling like they are the provider and that they don't want to be taking time off work due to illness, and that they want to be able to be there for their family and do all this stuff. Preventative healthcare is so important there. Coming into us for half an hour to discuss maybe a couple of little niggles you've got about your physical health can save you possibly weeks or months of having to take time off work later down the line. And there's a whole host of reasons as to why people don't want to take time off. And it's not always avoidable. But if we can get in there a little bit sooner, and if you are having regular checkups and, just spending a little bit of time every so often on yourself, on your own health, it can make life so much easier and mean that serious illnesses and taking loads of time off work is a heck of a lot less likely.
And just like women, men may decide they want to make a change in their life. It might be they want to start losing weight, but they're not sure where to start first, because we get so much information bombarded at us about what to eat, what not to eat, how often you should be in the gym, etc. Whereas I think a good marker at first is to perhaps book in with a doctor and have a full blood check and check where certain levels are, etc., before you end up doing more damage by hitting the gym 24/7 and etc., deciding to cut certain food groups out of your diet, because I think it's not necessarily the best route to go by just taking advice online. I really do think you should come in, invest in yourself, speak to a doctor and let them give you the picture. And then when you've got the information, then we can put plans in place to get you where you want to be.
It's that, I like there that we have the flexibility of how you want to come into this. A lot of people will go and have a look online. It's natural.
Of course, we all do it. I've done it.
Totally. And we've had a lot of patients that come into us after looking online and say, I want this blood test, this diagnostic test, this blood test done. That's absolutely fine. It's the flexibility of, do you want to speak to the doctor first to have a look at those and maybe tailor that ever so slightly to your specific problems? If you want to go ahead and have those tests done first, that's absolutely fine. And then if you want, we can then provide a doctor to discuss those results with you. My concern there is always that you'll come into it, do a few tests that may be unnecessary, and then after your discussion with the doctor, then go back and want to do more tests that are more tailored to you. So I think I'd always err on the side of having a chat with the doctor first to decide what sort of tests would help solve the problem that you come in with.
Because of course you don't want to be paying for a test that you don't actually need.
No, totally. But as we said, people can be really, really switched on with their own health. People do know their own bodies pretty well, and some people come in and go, you know what? Yeah, I do want this test. I want this test. That's fine, and we can start off with that so that we're not wasting people's time and money with unnecessary consultations. It works both ways. You don't want unnecessary testing. You don't want the unnecessary time with the doctor where nothing's really happening with that. And I think you have to work that on a case-by-case basis. And that's what we're good at, is tailoring things to an individual.
Absolutely.
Yeah.
So that concludes our discussion today. Thanks so much for listening. Do keep looking out for any social material that we put up about other topics that we're soon to be discussing. But in the meantime, I hope you've liked what you've heard. If you do have any questions, please leave us a comment. But don't forget to follow us on all our socials, and we'll be back with you again soon.
Bye-bye.
Bye-bye now.